That is the required notice. And then I also just want to say, hi, good evening. This is the regular meeting of the Public Health Advisory Committee. My name is Jerome Evans, and I'm one of the co-chairs of the committee. I'd also like to introduce Kathy Tuzinski. Would you like to wave, Kathy? There she is. Thank you. Before we begin, I'd like to note that this meeting includes the remote participation of members as authorized under Minnesota statutes section 13D.021 due to the declared local health pandemic. I will now call this meeting to order and ask Hattie to call the roll so that we may verify the presence of a quorum. Go for it, Hattie.
Hi, everyone. Terry Ann Jones.
Here.
KJ Starr. Mary Pike.
Present.
Johanna Berry. Johanna Berry. Kozar Mohammed.
Here.
Al Pentel.
Here.
Anna Arkin. I think she's gonna come in a little later.
Yeah, she sent an email.
Laura Rangard.
Present.
Jerome Evans.
Here.
Kathy Tuzinski.
Here.
Rick Culp.
Here.
Wanda Felder. Wanda Felder. Angela Watts.
Here.
Craig Hedberg.
I'm here.
Yolanda Adams-Lee. Yolanda Adams-Lee. Aaron Hurley.
Here.
Johanna Berry. Wanda Felder. Yolanda Adams-Lee. Okay, we have 11 members present, and that's a quorum.
Fantastic. We're now going to move to the adoption of the agenda and the acceptance of the minutes from the last meeting. Recall that we can do both through a single roll call vote.
Were those emailed out? I tried to search in my Gmail for them and I didn't see them. Did I miss them?
They are in the agenda for this meeting. There's a link.
Angela, you have a question?
No, I just saw Wanda Feldman's trying to enter the room.
Yeah, she said that something with her work settings won't let her join the video.
No, that was me. I can't join video. This is Aaron.
So sorry, Aaron.
Wanda, are you here?
I am here. Hello.
Hi, Wanda.
Wonderful. 12.
We have 12 members present tonight.
Okay. Britt, were you able to access the minutes?
I am not finding the email that they were sent out in, unfortunately. If anybody could quick forward those to me, I would appreciate it.
Yeah, I will actually, because there's other things, I will put a link in the chat here for that on LIMS. Are you able to get to that? Yes, okay, because that has a few other items in there as well that will be important to be able to access.
Thank you.
I think, where's the chat feature? This is Terry Ann. Where is that? I'm not familiar with Teams. Where is the chat feature? I don't see the minutes either. I want to look at them too.
Yeah, so do you see the little hovering bar above the screen? The chat is that little conversation bubble.
It looks like a cartoon bubble.
Oh, got it. I got it. Show conversation. Got it. Okay, cool.
Yeah.
Thank you.
Okay. And we'll just give everyone maybe 30, 45 seconds to check out the minutes. They were pretty slim.
Mm-hmm.
It's not a small novel. You're okay. And we'll make sure that we can proceed. Okay, Britt, did you see anything that you objected to in the minutes?
No, no objections.
Okay. Terry Ann, were you able to get to the minutes?
I did, and I too have no objection.
Fantastic. Well, then I am going to ask Kathy to move that we accept the minutes and the agenda for this meeting?
Oh, I move to accept the agenda for this meeting and the minutes.
Wonderful. And Angela, since you're unmuted, will you mind seconding?
I will second.
Awesome. Hattie, will you take the vote?
I will. Terry Ann Jones,
Yes, approve.
Mary Pike,
Approve.
Kozar Mohammed, Paul Pentel,
Approve.
Hannah Arkin, are you here yet? Laura Rangard,
Approve.
Jerome Evans,
Approved.
Kathy Tuzinski,
Approve.
Britt Culp,
Approved.
Wanda Felder,
Approve.
Angela Watts,
Approved.
Craig Hedberg.
Approved.
Yolanda, are you here yet? Aaron Hurley.
Abstain.
Okay, we have 11 approved, or it's carried.
Wonderful. Well, then the first or the next item on our approved agenda is a presentation from the City Division of Race and Equity by Joy Marsh Stevens. Is Joy in the room with us?
Hi, I'm here.
Hey there, welcome. Thank you for joining us. I think we're all very excited
Woo.
for the presentation and conversation today.
Fantastic. Well, then I'm also excited.
Wonderful.
So I don't actually have a formal presentation. I noticed that there's a couple of links that were added to the agenda for some resources that our division created to support city staff and community and understanding how the racial equity impact analysis process works. So I am happy to talk through both of those resources and answer any questions that folks have around that. And I'm curious, before I just dig into that and give you the old racial equity impact analysis dog and pony show, to have a sense of what's kind of the impetus around the questions, and if there's a way for me to speak more specifically to that would be, I think, maybe beneficial for everyone. I don't want to just ramble on if there's a specific kind of area of interest that folks have.
I think specifically for this committee and the city's recent declaration of racism as a public health emergency,
Okay.
We are very interested, I think, not only in what the city is doing now and in the future, but maybe how we got to this moment from your perspective, how we let racism get to a point of having to declare it as an emergency, if you have any feedback or insight there. And I know I have some particular questions about the impact analysis. Was there an impact analysis before? Is this the first attempt at one for the city? And once we dive in, I'm sure more questions will come up. That's from me. If anyone else has questions, you can raise your hand in the chat, or if you're on the phone, you can just say that you have a question, we'll call on you. But I bet this is going to be an exciting conversation, so I want to make sure we've got some structure. Margaret, I see you've got your hand up.
Yeah, so Joy, I just wanted to say that really this topic came up most passionately in response to the murder of George Floyd and the civil unrest that happened in May. Unfortunately, during March, April, and May, the PHAC was not allowed to meet by the city clerk's edict that no advisory boards meet until they had the MS Teams figured out and how it was going to meet open meeting law. So when we gathered in June, truly, like, our whole worlds had changed. Sure. And our June meeting was almost entirely just spent on checking in with people to see how they were feeling, to see how their neighborhoods were doing, how their families were doing. And it was quite a passionate sharing. a lot of vulnerability, was kind of put on the table here, because PHAC members, I think, felt that this was a safe space for them to be able to speak honestly and openly about the impact that the murder had on them personally, that COVID had on them personally and professionally, as well as, kind of any of the civil unrest, some of which, our members were participating in, some of which our members were really in kind of lockdown inside their homes for a variety of reasons. So after that meeting, then, there was really some goal setting that went on, I think in July, just in terms of how could we act more intentionally as an advisory committee around racism. And one of the desires was to have a workshop really from the Department of Race and Equity, which really just turned into an opportunity for you to kind of chat with the committee about the department, the Office of Race and Equity, and then there was interest in reviewing the equity toolkit because a number of people had commented that there must be a toolkit available, and how can it be used to drive both PHAC decision making as well as be used by the health department for decision making. And so voila, you're here.
Okay, so that is all really helpful, and I really appreciate the context. I'm someone who very much values context, so that was super, super helpful. So what I will say to your question, or to your point, Jerome, around kind of how did we get here and the impetus behind the resolution. The resolution definitely, while it was spurred on by the civil unrest following George Floyd's murder and the community outcry, both locally and internationally, around structural racism and anti-Blackness and anti-American Indian sentiment. I mean, that was kind of more of a localized impetus behind it. But as you've seen, if you're familiar with the resolution, it's rooted in centuries of policy locally, regionally, nationally, that has perpetuated whiteness as the standard and marginalized historically Black American descendants of slavery and American Indians and other people of color over time. And so the call for that racism as a public health emergency was really about marking the specific moment as an opportunity for us to not just talk about racism the ways in which we've always talked about it, as particularly as a city of Minneapolis, who is known locally and nationally as being very progressive, but really naming the significance of it and the need for us to really ratchet up our work and our efforts. And I think the timing of naming it as a public health emergency is also compounded by the COVID pandemic and the reality that we're all really facing and focusing so much of our lives and our attention on the public health crisis that is COVID. And as a result of that, also acknowledging that structural racism is also another pandemic, and it's one that we, particularly those of us who identify as either historically Black or American Indian or other communities of color, have lived with for centuries and generations. So that's really kind of the impetus behind the resolution itself. Within it, it talks a lot about the history and talks a lot about the opportunities that we see inside of the organization. Some of its work that's named in there that is existing work and really central, and centering that work inside of the resolution to give greater weight to it, as well as identifying additional opportunities that may be more places for emerging work for us to be doing as a city that also tie to structural racism.
So, thank you. I love that. Regarding the documents that were presented to the committee, would we say that these documents and this analysis existed before the declaration, and now they're being pulled out front and center because of the declaration, or were they created after the declaration? And then Margaret, you're next.
Sure. So, great question. The racial equity impact analysis process was named as part of implementing the city strategic and racial equity action plan that council adopted in July of 2019. So the racial equity impact analysis is not new. It did not emerge as a result of the resolution. It's not tied to COVID or to George Floyd's murder. It is something that we have been actively working towards developing and implementing for quite some time as a city. It was just, it just so happened that a lot of the active implementation of it seemed pretty parallel to COVID and to George Floyd's murder, but it existed. Our work in developing it and researching other jurisdictions and creating it and developing the tools like those that are linked in the meeting agenda, that has been ongoing work for quite some time within the Division of Race and Equity. Mm-hmm.
So Margaret, you put your hand down, so I'm going to sneak in another question and provide Joy with more context. One of our driving motivations, at least as it regards racial equity, is making sure that the city council doesn't just declare, make a declaration and then drop the ball or not move forward. And so we want to make sure that we apply, as many Neapolitans, just enough pressure on them to keep it front and center. Like, we want to know what we're doing about racial equity in our city. And so even that we haven't gone through the documents yet, and I apologize, one of my questions regarding the impact analysis is that it didn't seem to reflect racism as an emergency in the documents. And I didn't know what your take might be on that. Because it's very conversational, really. It's very, almost hand-holdy. Whereas when I think about an emergency, I'm thinking, no, we're not going to tolerate certain kind of behaviors, or, don't bring us any racist policies, please. Might have been a statement that I would put on a document. So I'm just curious about your insights there.
Sure. Well, and so it may be helpful to just talk a bit about the purpose of a racial equity impact analysis and how it's used.
Yeah.
The racial equity impact analysis is designed to change our behavior as city staff in relationship with policymakers and with the community and how we think critically about race in our decision making. The racial equity impact analysis that is mapped out within the documents that are linked is the one that is most closely aligned with our legislative process. The implementation of a racial equity impact analysis within the legislative process comes with a set of key places in which it is required for city staff to follow that process when they want to bring something through to council. So if we are introducing a new resolution or a new city ordinance, or changing a resolution or a city ordinance, or if we want to make a change to the charter, if we want to impact the budget in some sort of a way, if we want to create a new city policy, the requirement is that city staff have taken the time to complete a racial equity impact analysis process. What you see mapped out in the documents is kind of like the form where you show your work. It's not the work itself. The work itself happens when I, within my department, am engaged by a city elected official and the community to say, hey, we want to create a new resolution on whatever it is. And the process that's mapped out within the racial equity impact analysis process tells me how I should go about doing that in a way that helps make sure that I thought critically about the impact of that decision on our Black, Indigenous, and people of color inside of the city of Minneapolis. So by elevating that process and requiring it to aid council members and the mayor in making decisions around resolutions, ordinances, citywide enterprise policies, the budget, et cetera, that is how we give the gravitas to it, and that is how we ensure that it is something that we're taking very seriously.
Thank you. I'm really loving this conversation. Angela.
Hi, Joy.
Hi.
I know you've been at this work a long, long time, as many of us have. I think a couple parallel things happened in the course of the evolution of your work and the city's journey toward racial equity. And as you know, we've been looking at training and policies for a long time, yet these troubling events still keep happening, with Minneapolis being the epicenter, what's happened specifically in the police department. I think the fact that the training officer was the key officer that, was the perpetrator in Mr. Floyd's murder, all think and step back and pause, like, despite all the historical timeline, the work that we've done, we're still at this critical point. And so in declaring racism a crisis, an emergency, I think people are wanting to see a more elevated response to this. And what can we do to help push that so it becomes more of an elevated response rather than a process type of response?
So it's so good to see you, Angela. It's been forever. So what I will say is that a couple things. One of the benefits which is, and I'm not saying this to in any way disparage any other city council members, but what I will say about the fact that this is a resolution that has been authored by Council Vice President Jenkins and Councilmember Cunningham is that these are two council members who have demonstrated a commitment to making sure that the things that they sign off on or that they author actually get implemented with fidelity, which again is not to disparage any of the other elected officials that are there, but I know our office works most closely with those two city council members and their desire to ensure that this resolution is not just adopted, but is actually implemented and that it remains at the forefront of our thinking and our decision making as a city is something that I have confidence in. I think part of the opportunity for us as city staff in relationship with community as well, and with elected officials as well, is to make sure that we are taking this very seriously and implementing this as thoroughly and with fidelity as we can, but also recognizing that what it is that we are unraveling in the form of structural racism, that is something that, as we all know, it didn't happen yesterday, so it's going to take longer than just tomorrow to undo it. And so progress is incremental. It's not seismic. And even the work that we have been doing, even as a city, as we sit inside some of the starkest disparities within the nation, it's not a reality that we sit in without recognizing that parallel to that are significant policy-based moves that the city has been making. This is a council and mayor that, in particular, when I think about my work inside of my team's work inside of the Division of Race and Equity, honestly, I don't think I've been as busy as I've been in the 5 years since I joined the city than I have been since this council and mayor. I mean, these are folks who are cranking out policy and making moves in ways that I have not experienced in the prior administration, and in doing so with a sense of urgency. At the same time, doing so battling things like COVID and George Floyd's murder and civil unrest and all of that, and trying to be responsive. And I take great comfort in knowing that there are Minneapolitans and constituents who refuse to take the foot off the gas as it relates to this specific topic. Because it's going to take a lot of time, and quite honestly, it's going to take a lot of continued willingness to stay this energetic around these topics.
I'm curious, what pushback have you gotten, if any?
Aaron, I think that was you, and there was an echo. Are you possibly on two things at one time?
Maybe. I tried to get off my work computer.
Okay, just mute one of them.
So the question about pushback, I'm unclear about what the reference is for that. Is it pushback about the resolution, pushback about the racial equity impact analysis?
Yeah, I mean, ultimately, for example, can you hear me okay? Yeah, ultimately, for example, I mean, it comes to mind environmental impact or any other type of mandated regulatory review prior to change in policy. You inevitably get people that are say, oh, is there the cost benefit analysis of doing something like this is too much? Have you encountered anything like that, or has it been, have you found that to be genuine? What added cost to this is there, if any?
Added cost to following the process itself? Is that the added cost question, that reference?
Maybe Aaron couldn't hear once he was able.
Oh, so Aaron, the question about added, okay. So I'll just generally answer the question as I understand it. So I would say the question about pushback, as you can likely imagine, racial equity work requires people to be really uncomfortable, and particularly to think about their work in new and different ways, particularly taking the time to actually follow a racial equity impact analysis process in a thoughtful way to seek out and to understand data, for either qualitative or quantitative data that's racially disaggregated, taking the time to actively engage individuals based on that data who are most disproportionately impacted by whatever sort of policy outcome, taking the time to listen to them and to co-create solutions that help to mitigate some of those disparate outcomes and to reverse some of those racial disparities. Like that takes time, and a lot of the opposition that might come is largely about is largely about a lot of that. So there's a lot of factors that come into play: work avoidance, lack of willingness to plug in, fear, bias. All of that is going to show up in individuals when it comes to the work. And it's less about specifically a racial equity impact analysis as just about racial equity work, period. The thinking of, well, this isn't my job. My job is literally to follow the 5 things on this clipboard every single day in order to do my work. It's not to do these other things. So it's not unique to this specific effort. What I will say for Minneapolis, though, is that we enjoy a pretty well-earned reputation of being really caring about these values. So the value around racial equity is not new to the city of Minneapolis. It's something that we have been espousing since long before I came and joined the city in 2015. And so city staff, by and large, recognize that this is something that is important to us. And if nothing else, what I'm seeing since George Floyd's murder in particular is a growing interest in being thoughtful around how we can embed these resources into our work. Now, the city of Minneapolis has been around for over, 150 years. The racial equity impact analysis has been implemented for 1 year. So, I mean, comparatively speaking, we are definitely seeing growth in the utilization of it in its myriad forms, both in the legislative process and our budget process, and additional places where we are requiring it into the future. And so what we're seeing is an emerging utilization of it that is forward moving and giving us reason to hope, but also recognizing that in the grand scheme of things, we're very, very new as a resource for city staff compared to the long history of both the city and of structural racism over time.
Wonderful. Thank you very much. So given that you are brand new, or that the work is new, rather, I do wonder if your department or the city has articulated strategic goals relating to eliminating certain disparities. Have we prioritized the elimination of one disparity over another? Or maybe better rephrased, how would you measure success if you were to quantify it in some way?
Sure. And so I just dropped into the chat a link to the city's strategic and racial equity action plan, which predated the racial equity impact analysis. This is the policy document. This is a guide to the policy document that council adopted in 2019. And it includes 7 priority areas for advancing racial equity within a 3-year period. It is by no means meant to reflect the totality of things that the city cares about when it comes to racial disparity. So example, you won't see things in here related to the environment or transportation or other areas that the city works in on an active basis and has presented and communicated priorities there as well, as it relates to advancing equity. What this specific plan is intended to do is to reflect the priorities that council and mayor set, with the expectation that within a 3-year period, we are able to realize concrete progress in these areas. And so it's meant to cover the last 2 years of this council mayoral term as we come up to the first of those 3 years, into the last year, next year, and then into the first year of the subsequent council and mayoral term, to allow for some degree of consistency across terms. That's how it was designed to be used. So this, to the question that you raised, identifies what those core priorities are, but again, it's not intended to be exhaustive, because we care about racial equity in everything that we do. And per the conversation about the racial equity impact analysis, we're asked to think critically about race across the board. It's just these are the 7 areas where we're paying an exceptional amount of attention, including making quarterly updates to our city council on progress on each of these different priority areas. The next one's scheduled for tomorrow, conveniently.
Thank you, Joy. Kathy, your hand is up.
Yeah, I just wanted a quick first before I go though. Erin, did you have any other questions or comments?
Nope, thank you.
Nope, okay. So I guess I might have missed this, Joy, and you might have said this in the beginning, so I apologize if I missed it. Is this going through this process here, is this considered a requirement of departments? Can some departments say, well, we never heard about it, or we don't know about it, or, you know, or we don't want to do it, or for whatever reason? Is this now just, is it something that is more of a guidance and advisement versus something that's required?
So there are several instances when, am I able to share a screen? Can I do that?
Yes.
All right. I'm going to share my screen here and show you, and let me see. So within the racial equity impact analysis, you will see, and again, this one really speaks most specifically to the legislative process when we talk about how this document is designed. And it tells us on whatever page this is, I'm sorry, I don't, whatever this specific, so page 2, it talks about both common situations when it can be used, both in policy, programmatically, or with regard to the budget, like when it would be valuable to use a process like this, and then secondarily, when it's required. So these are not optional spaces for staff to decide when they want to do it. So for the legislative process, specifically within our legislative information management system, anytime a city staff person is coming in to create a request for council action tied to a new or update to an ordinance or resolution or charter amendment, et cetera, the system will require them to complete the actual racial equity impact analysis form that is their place to show the work that they've done, ideally by following that process from the inception of whatever idea they had. So it's not optional. With appointed boards and commissions, it's also a council expectation that we utilize the racial equity impact analysis. Because of COVID, because many ABCs have not been meeting or are just now really starting to meet again, we have been slower to implement this work, but have begun doing some of that actively, particularly with staff who support appointed boards and commissions. So my staff is currently in the process of working with the clerk's office to really understand, and some appointed boards, I'm not entirely sure which ones we're collaborating on, but really to imagine what that process looks like, particularly since there is not a formal process that all ABCs use when providing their advisory guidance back to the city on policy. So we don't want to just assume that the same process that staff uses in the legislative process is going to apply most appropriately to boards and commissions. So yes to it being required. how it shows up is going to be different. How it shows up in the legislative process is different than how it shows up in the budget, for example. There are a core set of questions that we have built in, that along with the budget office and the mayor's office have built into the budget guidance, so that all departments have to respond to those questions and talk about an equity impact as they are providing and submitting their budget requests during our budget process. So it's still a form of a racial equity impact analysis. It just looks different because the circumstance looks different. With our programmatic review, for instance, our results Minneapolis, which happens annually, and departments are providing that that program analysis. We're building in some of that deeper language for departments to also reflect on their ability to address racial disparities within their annual work, as well as within our internal audit, collaborating with them on how to more deeply shape racial equity into the audit process.
Great.
Yeah.
Margaret, I see your hand is up, and then maybe at like 6:45-ish, I feel as though Joy will not have a voice for her meeting tomorrow if we hold her for too long. So please raise your hand if you've got other questions. Go ahead, Margaret.
Oh, I was just going to add that the staff for the appointed boards and commissions, so like Hattie and I and others who are the city staff, associated with an advisory board, just received a training on the racial equity impact analysis last month. So I know that the city clerk has a plan in place to sort of roll that out. And it won't necessarily, get rolled out, as you said, Joy, to all ABCs, at first, but we did receive a training on it. So, the process has started for us to understand what it is, how it will be used for our advisory boards. And then, there will be more kind of training provided to and support, provided to ABC staff, in the coming months.
Yeah, definitely. And I would also add that because all ABCs are different, and we made this offer to ABC staff when we came to the meeting last time and did a high-level training, is to help us understand. So if there's feedback that you want to offer to us and what would make sense as far as either infrastructure that's needed in helping to implement a process by which ABCs are able to adhere to some sort of a process like this, or other sorts of capacity building, because we also recognize that not all Minneapolitans are at the same stage of their own racial equity, their critical racial equity, and their ability to provide a critical racial equity analysis. And so simply by putting a process in front of folks and saying, think about these questions in this way, if I don't have some foundational understanding, then that might be a little difficult for me to do. So we're definitely open to and very interested in hearing feedback from our ABC staff and our ABC members as well, as you familiarize yourself with this process and what it's intended to communicate to city staff and the purpose of it and why we use it. Please definitely either feel free to share that with us directly inside of the Division of Race and Equity. We're at, race equity at minneapolismn.gov, or if it's more appropriate, Margaret and Hattie, for them to share that through you, that's also fine. But we're definitely, like I'm just saying, we're definitely interested in hearing it.
Fantastic. Margaret, your hand is still up. Did you have another question?
Come on, man. I'm trying to lower it.
Oh, it's okay.
There we go.
The other resource that I dropped into the chat that I didn't actually speak to, so the larger document that is the guide for the Strategic and Racial Equity Action Plan talks about that process to develop it and the purpose of the plan overall. The second document that I added is a one-pager, and it's more of the detail around the policy priorities. Most of the content, with the exception of the strategic need statement that was adopted by council and is policy and can't change without council action, the other elements of it can change, and they're designed that way because as we begin to implement towards the goals, we learn more. We learn more about, for instance, what the data is telling us, what the impacts are. We see more about the outcomes. Sometimes social and other political factors shift, and our ability to move some of that work also shifts. And so as a result of that, we have to find new and different ways to meet that strategic need. So this one pager, or I guess two pager front to back, is something that we have separated out from that broader guide that doesn't change. And then this is a document that we update regularly as necessary to reflect our emerging understanding about goals and success measures and whatnot. So they go together, they complement each other.
Thank you. As a big nerd, I am excited to get into these documents and really spend some time. In the last couple of minutes, I really just want to express the committee's appreciation for the work that you do for our city, that you took time to come here today. And if there is any support we can lend you in this work, I think the committee would be very open to that conversation with you.
Oh, yeah, definitely. And I will say, always interested in hearing the feedback, although I feel pretty confident that the staff inside of Race and Equity are very adept at engaging with community, and most folks in there come from some community-based work that they've done. If not everyone there either has come from some community-based work that they've done and has really strong community connections. I don't know that we're ever at our threshold of hearing from community and voice. And so if you're seeing that there's opportunities for us to more deeply engage or to be more transparent in the work that we're doing, then please definitely let us know that. And feel free to, again, email us at raceequity@minneapolismn.gov. That is a definite place for some support. One of the things that I don't think I mentioned previously around the resolution, the Racism as a Public Health Emergency resolution, is that my office and Gretchen Musicant have been working very actively on building out a process by which we implement that resolution, and have begun mapping what those steps look like, along with Council Vice President Jenkins and Council Member Cunningham, so that we make sure that we're not just passing policy, but actually taking the necessary steps to implement it. And as I mentioned, some of those therefore statements reflect existing work that's been named other places, like the Strategic and Racial Equity Action Plan, but others of those are emerging work. And so we are actively, like, I've organized some of my staff, and I know Gretchen is organizing some of her staff to come together and figure out how we actually make sure that that thing becomes a thing.
We are interested in the thing and hope to hear more about it when it's ready.
Yeah, for sure.
Thank you very much, Joy. We really appreciate it.
Yeah, sure. Anytime. Thanks so much. Have a great night. Thank you for your service and your commitment to the city of Minneapolis. Definitely. All right. Bye.
Have a good day. Bye-bye.
Thank you.
That was wonderful. Next, we have reports from Noya. Was Noya able to make it today?
I have a written report from her, but before we move on, I'm just wondering if there's any other conversation that the committee wants to engage in around this information that was just provided. You know, if there are any questions that maybe didn't get asked that we can collect and gather, you know, and sort of send to Joy. Clearly, she wants to hear, you know, if there's any additional information that you want to share with her or questions that you want to ask. So I just wanted to take a moment, you know, and get some initial reaction, and that can just be, you know, from people volunteering. You know, we can go around the screen and you can offer one word, you know, or something, you know, is that let's hear what you got.
Let's do that. Let's also remember that we have a conversation on our letter to the City Council coming up as well. So you will get 2 bites of the apple on racial equity today. And I'm gonna pick Laura to go first because she helped write the letter. So I know she's pretty knowledgeable. Tell us what did you think about the presentation?
Well, I think I felt a lot more informed. Because I think it was really helpful to see additional information about the strategy and what the policy looks like. I'm really excited. I know it's just a form and it's a process, but it's a step in the right direction, at least, that you're putting people through a process of analysis so that they have to think and consider something. So even though, I always think about an inch, like, can we get 1 inch, 1 inch better? So all of those things, I think, left me feeling more informed and more inspired, I guess.
That's wonderful. I see Margaret is taking notes. What I'm going to do is, just to make sure everyone has a chance on this topic, so I'm going to go down the list on my participants panel. So it'll be Anna, then Craig, then Britt. And just to give Anna a little space, I will give my input. I was very impressed by Joy. I think it's always really reassuring when you've got someone competent in a position doing work that you really care about. I think I asked most of the questions and she was able to respond very comprehensively and thoroughly, and I left feeling more educated than as I came in. So I was like, yes, okay, let's elevate Joy and her work and her expertise as much as possible, because she's clearly bringing us farther than an inch. Every day, I think. Anna, are you available?
Hi, yeah. Hi, everyone. I joined late, so I missed the first part of the conversation, but I echo what you were just saying, that Joy seems amazing. And one thing one topic she touched on that I thought was good to hear was talking about how the mayor and council are really invested and are working. There's a lot of policy work going on behind the scenes that I don't think we always hear about. And I know there have been a lot of criticisms and feelings like that there's not a lot happening, I think, especially at the mayoral level, at least from what I've read and heard in my circles. And so it was, I guess it was just good to hear that there's maybe more going on than more outsiders are aware of.
Agreed. It'll be Craig, Britt, then Aaron.
No, I think this was very informative, and I like the approach that is being taken and the thoughtfulness that goes into sort of evaluating the impacts of policies, because frequently, policies start out with one idea to push forward, which always seems like it's a good idea. But then there's all these ripple effects that are hard to anticipate. And this is a process of trying to anticipate sort of, what that process, what those impacts might be. And I think it's very useful. I shamelessly will actually pass this on to my colleagues in the School of Public Health who are dealing with these issues in our own administration. And I think that this type of an approach could be very valuable for us.
Oh, wonderful. Britt, Aaron, and then Kathy.
I thought it was really informative, and I really enjoyed the links that Joy sent out, because I'm a visual person, and it really helps me integrate with processing, seeing it right in front of me while I'm listening to her speak. And I mean, I'm looking forward to sharing some of this with some of my other circles, because I do hear it quite often where it feels like a lot of the BAPOC residents of the city that I'm friends with or that are in my circle feel largely unheard still. So it is good to know that there is action, that's measurable action that's being taken.
Fantastic. Aaron, with the cool jack-o'-lantern in the background, Kathy and Mary.
Oh no.
You're muted.
Oh.
Can you hear me now?
Yes.
Yeah.
Okay, yeah, I was trying to be a little festive today. Yeah, I thought the advantages were were two. One being that people who may not have considered the racial impacts are going to be forced to consider them. I mean, so often you see that in missteps with social media campaigns or advertisements, and it's like, well, if they had had a more diverse input, they might have considered that, the impact of what this is actually saying. So I thought that was good. And coming from, Jerome, as you know, a legal background, I tend to prefer something that you can hang your hat on. Mentioned the environmental impact policy, where you can't do anything that's going to affect the environment without doing that. I think it totally makes sense for a city like Minneapolis that has the history of issues that it does. So I 2 thumbs up. I thought it was good.
2 thumbs and a jack-o'-lantern from Aaron. It's Kathy, Mary, then Paul.
Okay. I really loved it. I wish we could have had her talk for a couple hours. I feel like we need a lot of joys to, really help to get this integrated into just the fabric of how things are done. I'm thinking about what she had said as well, Anna, about the city council and how she has been impressed with this city council and the mayor and how many things they've done. And I contrast that with some of the stuff I see on social media, people in my neighborhood who are like, vote them out. They're awful. This is the worst city council ever. And it scares me because of the vagaries of politics and how things move and go from one extreme to another. And I don't want to see that happen. So I'm thinking, how do I, with my time off of PHAC, do I get involved in making sure that people can all vote for city council members, and that, we continue to have a representative city council and not one that's dominated by this loud group in Southwest Minneapolis. And I also just thought the whole process, like Craig had said, I would love to be able to see that in organizations, in thinking about the decisions that they're making, policy, whether it's their employees or their customers or the people they're serving, that they're really putting it through that instead of this sense of urgency of we need to make a decision and we need to do this now. I feel like there's so much false sense of urgency that results in poorly made decisions that doesn't take into account everybody who's should be at the table. So,
Great. Margaret, you raised your hand, but after Margaret, it'll be Mary, Paul, and then Terry Ann.
Yeah, I just wanted to respond to both a comment that Craig made and now a comment that Kathy made, is that, these are publicly available documents, so they are not state secrets. You can copy the link, put it on your own social media when you're responding to people, on Nextdoor or Facebook or Twitter. You can put the document right in there. It would lead people right to the plan. It would lead people right to the 2-pager. I just encourage you to use, share, copy, promote. Because that's how you raise sort of all of our awareness, right? That this is something that the city is engaged in. So yeah, I just wanted to jump on those 2 comments before I forgot.
Did you have a thought of your own that you wanted to add regarding the presentation, or have you already expressed?
Is that me?
Yeah, just asking while you were speaking.
Yeah, no, I was really glad to hear Joy talk about it. I know that this is work that she has incrementally been working on since she came to the city 5 years ago, and really started by engaging the city itself in a strategic planning process. and then, you know, was able to sort of put together that strategic and racial equity action plan, and then put in place the racial equity, you know, analysis information. And the boards and commissions actually has been using you know, a survey for a number of years to find out from the boards and commissions how racially diverse or culturally diverse are the makeup of the members of the boards and commissions, and that's been reported on to City Council as a part of this process. So it has been an evolution, and that makes me excited, because it does seem as though the work that Joy has been doing over these past 5 years has really now started to kind of weave itself into, you know, the very fabric of how the city is functioning. So
that's very good to hear. Thank you. Mary?
Well, I am sometimes in despair when I look at inequities, in particular in education and health outcomes for people of color compared to more affluent white people. And I'm not patient. So it was good to hear about the things that are being done. And I have to remind myself, as Joy said, Minneapolis has been a city for 150 years, and we've just started this work in the last few years. And I can comfort myself with what Laura said, that even an inch of progress is progress, and we should rejoice in that. But I just want things to happen a little faster, and I know I have to be patient, but not too patient.
I was like, what joke can I make about how I'm not going to be patient?
I don't want to be too patient. We've been too patient for too many years.
I agree. Paul, Terry Ann, and Wanda.
Yeah, I agree. I think this is a worthwhile effort, and I really don't have anything to add to the other comments.
Thank you, Paul. Terry Ann?
Yeah, I guess that's the benefit of going last too, is being able to say ditto to everybody else's comments. The only thing I would add is that, you know, I was just thinking today, and I heard that piece on public radio about, you know, the very swift reaction this spring about removing the school resource officers out of the schools in Minneapolis. And, you know, the reflections from, I think it was North High School, who really had a very positive, strong relationship with their school resource officer, and now really thinking, maybe we were too quick to do that, right? We all just jumped on this bandwagon, this knee-jerk reaction. And so I really did appreciate hearing about this effort and this step back. And I think I too will share this because I think it's great information to pass on.
Thank you. It looks like Mary has her hand up, and then it'll be Wanda and Angela.
Yes, the public radio today talked about the beautiful article in yesterday's New York Times about, I think it's Officer Charles Adams, who was the school resource officer at North High School. It was a beautiful article, and I'll send that out. I don't know if you can open it. I hope you can, but it's well worth reading.
Mary, I miss you bringing me copies of the newspaper when we were meeting in person. That was always wonderful.
Thank you.
Wanda?
So full disclosure, I did have to step away because I had some mommy moments I had to take care of. But I am excited to see a written plan. As someone else stated, I am a visual person. I am happy to see that the city is taking steps, even if they seem small right now. It is steps as opposed to being stagnant. This correlates with work that I'm doing with the district. I am, and for our department, I'm on the equity and engagement team. And so this is information that I can take back to the team. And many of you may know we're in a citywide engagement, or we're changing our format of our districts and whatnot to hopefully for the schools to be more equitable moving forward. And on the kindergarten, as being a part of the kindergarten transition team, you know, I get a lot of questions from parents. What does that look like for my child? But I always believe that the district and the city need to be partnering in order to increase the equity for the kids, because they are residents of the city. They, are enrolled in the schools. We can't do the work without the support of the city. So this work excites me that maybe that can happen going forward.
Wonderful. A lot of people are going to be taking these documents out, which is a really great sign of them being good documents. Angela?
I think with me having known Joy since her inception of being hired and seeing the progress she's made, the marker she laid out for me was structural racism and the barriers. This type of policy work is not sexy or fun. It's really soul-bearing when you think about how a city is chartered based upon a very homogeneous demographic of Norwegian white men, when everything was homogenous and you could come together and make unilateral decisions. And now the diversity and depth and reach of how we've grown as a city, our population, new issues are emerging, and we're stuck with these old charters. So to be able to de-aggregate and uncouple this is a process. I just want to commend them for really trying to untangle. It's kind of like gum and hair, right? You got to wade through it. We want action right now, but we're all tied to these charters and these old rules and old ways of doing things. So this is a step in the right direction.
100% agree. Hattie, did you have a comment you wanted to share? Okay, if you are sharing any wisdom, you are muted. Okay, not hearing anything from Hattie. And then Aaron, are the last two numbers in your phone number 29? You can just nod if that's you on the phone.
Yep, they are. Yep.
Okay, great. Well, thank you everyone for your thoughts and your feedback. The chat is blowing up. Some people's insights were very well received. I love it. I think this is part of the really important work that the Public Health Advisory Committee does. And I'm excited to share this whole conversation since it's being recorded. So we are, I think, unless there's anything important in the chat, Kathy, is there anything that we're missing in the chat that I need to stop for?
No, I think just lots of appreciation for each other and our insights, which is wonderful to see.
Y'all keep the appreciation coming. I will manage through the beeps. And next, I believe that Margaret is going to read Noya's report. Over to you, Margaret. You're on mute.
I just want that to not happen in every meeting that I'm in. I have to put a Post-it or something up here, like "you're muted, dummy," or something. Alerts me. So unfortunately, Noya was not able to join us tonight. And I did request that she send us an update that I could read to the group. So that's exactly what I'm going to do. She said that Hattie is our move coordinator. As you may all remember, there is a brand new building being built in downtown. That is the place where all city offices are going to be consolidated between that building and City Hall. And there obviously will still continue to be, other buildings that are used for like public works and obviously police departments, and things like that. But in terms of trying to bring city staff back together kind of under one roof, we're all moving into the new building. They may even be starting, sometime late this year yet. Our move date is January 29th, I think, of 2021. So Hattie is our move coordinator. She's already kind of cracked the whip and told us that we all need to clean out our personal stuff from our cubes, that we need to start getting rid of all of our paper stuff that we can't take with us. We only have 3 small boxes that we'll be able to take over to the new building, which frightens me because I am very much a tangible person, as you can tell from me handwriting notes. But also because of my accreditation work, is that it's helpful for me to be able to see it on paper and to be able to make comments about how that work goes. So I'm frightened about our move, but it is going to happen whether I'm frightened or not. So the second point in her report is the number of encampments in Minneapolis has decreased significantly. Minneapolis Parks and Rec have encampments in only 5 parks now, which is down from a high of having encampments in as many as 20 parks over the summer. The largest single encampment is along the Greenway, and that is holding at about 100 tents. The report Noya gave us today to the department indicated that there is, it goes up a little, it goes down a little, people move in, they move out, but it's kind of holding steady. There is an encampment on a city-owned property in North Minneapolis, and it is a property that is being assessed at this time for some environmental concerns. That usually means things like either the amount of garbage that is there, which might attract rodents, or if there is needle use and needle disposal that is happening on the ground, if there are electrical lines that are being tapped into, or extension cords, that are, being used by generators or heaters or, that kind of thing. So folks in the city and the county actually do kind of an environmental assessment, and then they make decisions about, how do they notify people if in fact the encampment is going to be disbanded. And so there has been at least a notice provided to the folks that are living there that an assessment is going on, and that, that may mean that they need to be relocated. Of course, as we all know, the issue is, where do you relocate them to? There's never enough housing, especially for the concerns that, people have, the needs that people have, and the support, that they need. I can tell you that there are 3 different new shelters that are in progress right now and will be opening sometime between mid-November and the end of December. I did write back to Noya to ask a few more details about those shelters, and unfortunately didn't hear back from her. So I can kind of follow up with her and get some more information for us, because I thought that might be something that you all would want to know. But these 3 shelters will provide enough spaces to shelter most of those that are remaining outside right now, if they want it. So of course, no one is forced to move inside, but opportunities are provided. The health department has received a grant to provide outreach and education to the homeless population with a focus on IV drug users and those at higher risk for HIV and hepatitis C. We are partnering with the Aliveness Project and Native American Community Clinic on this project. The health department has also received a grant and are in the final steps of negotiating a contract with the Minnesota Department of Health to do some additional flu vaccine clinics in Minneapolis between now and the end of March. Most of those will be done in conjunction with existing COVID testing events. The Minneapolis Health Department also has 2 remaining testing events before November 15th. One is November 7th and one is November 15th. No, November 14th. One is the 7th and one is the 14th. I'll be sure and send you that information. They really would like to have these testing events publicized far and wide. We would actually love to be able to do 500 tests each of those 2 days. They are also being paired with flu shots. So flu vaccines are being given at the same time. So if you want a 2-for-1, or want to publicize a 2-for-1, it literally is, and I always say this, free. There's no pre-registration necessary. You can drive up, which might be preferable given, our wintry weather. You can walk up, you can ride your bike there. You don't have to live in the area where the testing is happening. You can live in St. Paul, like myself, and, go to a free testing event in Minneapolis because they're available. So I would just encourage you all to come and be tested and get a flu shot. For no cost. And, there's nice people like me, working out there.
1 second, Margaret. I saw Britt had a question pop up in the chat. I know you're reading from Noya's report, so you might not have an answer.
Yeah, and I can see her chat. So just HIV and HCV. Now let me see what it said. It focuses on IV drug users and those at higher risk for HIV and Hep C. That's as much information as I have.
We're just one of the things we're continuing to notice is that we are continuing to have our hospitals have higher amounts of individuals with high risk infections. And I am definitely not taking away from the importance of HIV or HCV, because we definitely started this 2020 all the COVID fun. We definitely started this year with an HIV outbreak, and we're still in an HIV outbreak, but we are also really needing to address like wound care, getting sterile water, getting like a consistent supply of safer works, because we are seeing so much with endocarditis, sepsis, cellulitis, MRSA, MSSA, all these other high-risk infections, and these are infections that keep people hospitalized for upwards of 6 weeks for IV antibiotics if they don't have stable housing.
Right.
And if people leave AMA and then they come back worse, and it's a continued stress around this, like everything. It's a stress around the human, the patient, and it's a stress around the system. So just hoping that it remains on people's radars.
Yeah, thank you. I did
aliveness is good with that.
Yeah, and I did write that down and can send that question to her, and then I can just CC you, and that way, you and she can, go back and forth about, what that means or what details she has, about that, because she'll be far more knowledgeable about it than I am.
Yeah, because I'm also in the weekly high risk infection rounds meetings at work, and I think that if we had something kind of on the horizon for especially the patients that go AMA with these higher risk infections related to intravenous drug use, then that can kind of help tie things together more, because we're just looping in healthcare for the homeless a little bit more, and just trying to figure out where we can patch up these gaps in care.
Yeah, sounds good. Thank you so much for that comment. The last bullet point that she has me reporting on for you all is that the health department is in the process of making decisions about which sort of trauma-informed tool or toolkit or organizational assessment we might use, so that we can start, with a self-assessment in the health department, and that would be like a total self-assessment for a trauma-informed journey. It would be looking at our policies, our practices, our personal beliefs. It would be addressing racism and equity and all of those things. And there are 2 work groups actually that are kind of working on these things together. One is like a mental well-being, mental well-being work group. One is the equity work group, which is one of the strategic priorities of the health department, is an equity lens. And so those 2 groups, obviously their work was paused, from like March until about July, as we were obviously busy responding to COVID, but the work has picked back up, and both work groups are very excited about the work, going forward. So we'll definitely keep you informed about that. And at some point, maybe, even those work groups could come and give a presentation to the PHAC about the work that is going on in the health department around these specific efforts. Yeah, and so that's basically it.
Okay, a couple of things. Kathy and Laura, since you took the point on the letter, if you haven't pulled it up yet, go ahead and pull it up because we'll probably ask you to read it. And while they're doing that, if anyone has any feedback that they'd like to send back to Noya, now is a good time to pass that through Margaret. And then Anna in the chat recommended the book, My Grandmother's Hands. And it's gotten 2 thumbs up and another comment that also got a thumbs up in the chat. For whatever reason, my chat won't let me give a thumbs up, but you'd all get thumbs up from me. And that book has come up a couple of times in this committee, and so strongly recommend it. And Angela, I see that you turned your video on and went off mute. Did you want to speak to either Noya or the book?
The author of the book, he's going to be at a conference at Kenty Circle, one of the keynote speakers tomorrow and on Friday. So yeah, high thumbs up. Just more of a comment. Highly recommend it.
Fantastic. Okay, seeing no other comments, we are going to move on to the letter supporting the City Council declaration of racism as a public health emergency. A link to the letter is in the agenda. And Kathy and Laura worked very hard on it, and they sent it to me for spit shine, and then I sent it back. They fixed it up some more. And so a lot of volunteer heart and time have gone into the letter. And take it away, Kathy.
Yeah. Oh, and then we also got some feedback from Angela and Margaret as well. So that was very helpful. So do we want to read the letter in its entirety, or do we want to give highlight? Okay, thumbs up on that. Laura, do you want to, should we split this up a little bit so that I'm reading some and you're reading some? Like,
I actually can't open any of the PDFs on my computer. So if you don't mind reading it, I can.
You don't have it memorized?
I don't have it memorized.
Okay, I will read it. Okay, so dear council members, the Minneapolis Public Health Advisory Committee submits this letter of support of the resolution declaring racism a public health emergency in the city of Minneapolis. As a resident advisory committee whose members have public health expertise, the PHAC advises City Council and the Minneapolis Health Department on policy matters affecting the health of Minneapolis residents, examines current and emerging public health issues, and serves as liaison between the city and the community in addressing health concerns. On the topic of racism as a public health emergency, the PHAC takes a special interest as the committee shares the belief that systemic racism is a major social determinant of health. This has been observed in each issue the committee has explored and examined, from issues of lead exposure, asthma, marketing of menthol, tobacco products, to impacts of climate change and adverse childhood experiences. The PHAC expresses full support for the resolution and the city's pursuit to name, reverse, and repair harm done to BIPOC in the city of Minneapolis. And that was in quotes because that is how they had written that in the resolution. The council has listed 10 actions that it will take in the resolution. We agree with these actions and hope to see resources allocated to these efforts in the city budget, complete with notations for how the allocation of funding, staff, and resources aligns with the goals set forth within the resolution. In this time of heightened scrutiny of our city, the PHAC believes that following up the resolution with clear, identifiable, and quantifiable goals that will name, reverse, and repair harms done to BIPOC is of the utmost importance. The PHAC also urges the council to engage with PHAC members, the members of other boards and commissions, and Minneapolitans to ask for our support and service. We do not believe that racial equity can be achieved exclusively by fiat or policy. We are all in this together. We all take part in systems that perpetuate inequities, and we will only achieve true racial equity by working together. Over the coming months, the PHAC will submit recommendations to council that we believe will improve the lives of BIPOC Minneapolitans. For example, PHAC will engage with the Public Health and Safety Committee to advance a proposal for increasing lead inspections and lead poisoning prevention in homes that the health department has identified as most at risk. We see this as one clear initiative that will help to address elevated lead levels in children, one of the most important health-related issues disproportionately affecting BIPOC communities in our city. We encourage the council to call on other boards and commissions and to call upon Minneapolitans. We've said this, I love that word now. I've seen it more now than ever. Call upon Minneapolitans to submit ideas and actions that may help us all achieve the goal of racial equity. Sincerely, the City of Minneapolis Public Health Advisory Committee, and then on the second page is a list of all of the members on the committee.
Thank you very much, Kathy.
Yeah.
Now we open up the letter for discussion. Did anyone see anything in there they liked, didn't like, that needs to be changed? And yes, Derek, thank you for reading.
So this is Craig. I think it's very nice. There is a typo. The next to the last BIPOC is spelled bio, BC.
Bio
PC, yes.
Okay, good one.
Good catch, Craig.
I think it's a very nice letter.
Yeah, I think it sounds great.
I think my favorite part of this letter is the piece where we're really emphasizing that it needs to name, reverse, and repair harm done to BIPOC in the city. So being able to really emphasize that need for accountability, especially with the naming, reversing, and repairing. So nice work.
That was the one that we quoted.
Mm-hmm.
So they wrote. So that was Cunningham or Jenkins who wrote that one.
Or staff.
I mean,
but sure, we'll take
continuing to put it out there, though. I mean, that's a really important step in the accountability process, which so many people seem to forget about, like not naming specific harms before they even try to apologize for them and creating these empty apologies. So actually naming the harms and what they want to do to reverse them is crucial.
Thank you, Brett. Okay, I'm not seeing any other hands. Margaret, does this letter require a motion?
Yes, it does.
Okay. I am going to ask Angela to move that the amended letter with the corrected typo would be submitted to council.
I make a motion that the amended letter with the corrected typo be moved to council.
Hey, Kathy, would you like to second? Oh, did Britt beat you? Britt beat you, Kathy.
Beat it.
And then Hattie, I haven't heard from you in a little bit, but if you could take a roll call vote, I would appreciate it.
You know, oh, sorry, who seconded?
Britt.
Oh, thank you.
Okay, here we go. Terry Ann Jones.
Aye, yes, approve.
Mary Pike. Mary.
Approve. Thank you.
Thank you. Johanna Berry, did you ever make it into the meeting? Kozar Mohammed. Kozar. Paul Pintel.
Approve.
Anna Arkin.
Approve.
Laura.
Approve.
Laura Rangard.
Approve.
Jerome Evans.
Approved.
Kathy Tuzinski.
Approved.
Britt Culp.
Approved.
Wanda Felder.
Approved.
Angela Watts.
Approved.
Craig Hedberg,
Approved.
Yolanda Adams Lee, Aaron Hurley,
Approve.
okay, that's 12 and it's approved.
Fantastic. I feel like we're getting a lot done in this meeting, and there's still more to go.
Also, I just wanted to say I'm sorry. I was answering the door. I could hear you calling me last time, but I was answering the door, so sorry. But I just wanted to say that this isn't new for the health department. We've always looked at our work through an equity lens. So for me, this is just more continuous work from what I know how to work from Gretchen and working in the health department.
Awesome. Thank you. I'm glad you're able to get that in. We have unfinished business, the lead presentation to City Council. Paul or Mary, would you like to bring the committee up to speed? Or Margaret, I suppose.
Yeah, I can update. Margaret is helping us get on the agenda for the Public Safety, Public Health Committee. That's for November 19th. So our small working group is mapping out a presentation. So we're just meeting a couple of times to get that together. We're going to meet next week with Gretchen to make sure that we're all talking about the same thing, even though this is an independent proposal. And we'll just take it forward.
Mary, did you have any thoughts to add?
No, I have nothing to add to that. That was a good summary.
I'll add that I've come into maybe the last 2 Zoom meetings that Mary and Paul have been leading, and they've been very productive and doing very good work. And I'm excited for the presentation to be done because I think it's something that we'll all be very proud of. Margaret, did you have anything that you wanted to add before we moved on?
No, I did. The only comment that I will make is that yay, finally, right? Because we were slated to actually give this presentation in the first quarter of 2020, since the committee had approved doing a presentation already a year ago. It was either in October or November that we actually approved giving the presentation to City Council, and we were expected to do that in the first quarter. So I'm just so grateful that the passion has continued, that the necessity has been recognized, and that we're actually going to get it done. So yay to all of you.
Yeah, the timing is actually a little bit fortuitous in that the health department just got a grant through Lisa Smested's efforts that's going to cover more remediations and part of the joint position that was requested. So it's a good time to come at the City Council with an ask.
Yes. And keep in mind that presentation is November 19th. It's public, so you can, and it's on Zoom, right? So you can put us on in your background if you'd like to join in. Otherwise, I'm sure we'll talk about it during the next PHEC meeting in November. Any other discussion on lead?
When we get that scheduled, I'll be sure and send out the meeting invitation or the meeting information to everybody on the committee. So if you're able to attend, it's all online. You can tune in from the comfort of your working at home or the working at your office. And so I'll make sure that you're all aware of that.
Awesome. Any other lead discussion? Seeing none, it looks like we get to the reappointment of Aaron Hurley to seat 20, which I don't think I've heard us refer to anything as a seat 20 before. Is Aaron required to give a speech of any kind for this? We do have about half an hour left in the meeting.
Aaron,
Okay.
hopefully you won't fill a half an hour of speech time, but just so that everybody knows what the process is, because Aaron fills a member at large seat, that the people that fill those members at large seats, like Yolanda, like Aaron, are approved by the committee to be brought forward to the city council for final approval or appointment to the body. So it is a way that the PHAC itself gets to choose who fills those 3 seats, and can also then at times make up for perhaps knowledge or expertise gaps, cultural, ethnic gaps that may exist on the committee, representation gaps. Maybe there is an organization that we want to make sure is represented, on the committee. And if we don't have a way to actually do that as a body, then, it's really sort of at the city council member's whim, or the mayor's whim, as to who fills the seat. Although I have found them all to be very intentional about that process. So this is an opportunity for all y'all to decide whether Aaron is going to get approved and further into his second term as a member of the PHAC. So now, Aaron, I can turn it over to you. Do you have any words of wisdom or gratitude or challenge for the committee?
I don't have any words. I'm not very wise, so I don't have any words of wisdom, but I enjoy this committee, and I believe that we should work towards social justice, especially in the area of health disparities, and there's a lot of work to do. And I'd like to be signed on for another term.
Well said, Aaron. Let's see, Angela, you were not muted a second ago. I think we just motioned to reappoint Aaron.
Motion to reappoint Aaron.
Awesome. Kathy, would you like to second?
I would like to second that motion.
Fantastic. Hattie, will you lead us through a roll call, please?
I'd be happy to. Terry Ann Jones.
Approved.
Mary Pike.
Approved.
Kozar. I think she might have left us.
I think you're right.
Paul Pintel.
Approved.
Anna Arkin.
Approved.
Laura Rangard.
Approved.
Jerome Evans.
Approved.
Kathy Tuzinski.
Approved.
Rick Culp. Britt, did you go answer your door?
You might need to come back to her.
Wanda Felder.
Approved.
Angela Watts.
Approved.
Craig Hedberg.
Approved.
Aaron Hurley. Oh, Aaron, does Aaron get to vote for himself?
I don't think so.
Well, that's too bad. Britt, are you back yet? Britt Culp? Okay, we have 10 votes. That motion carries.
I was trying to unmute myself and it wasn't unmuting.
Oh, you're there.
Yeah.
So, do you vote for Aaron?
Yes, absolutely.
Great.
Yes.
We have 11.
Well, congratulations, Aaron. That is unanimous amongst everyone that's here.
Thank you.
Absolutely. Thank you. Well, with that, we can leave the balance of our time for further discussion. And once the conversation gets slow or awkward, I will kick you out of this room and demand that you enjoy the rest of your evening.
I love the honesty. If it gets slow or awkward, I will end everybody's misery by shutting this down.
Oh, I can make it slow and awkward.
Are there any announcements that people might want to share information?
I reapplied and it sounds like it's moving forward for the mayoral appointee slot on the committee.
Okay.
Will you have me, Margaret?
Yeah, did you have a chance to meet with Heidi?
I chatted with her on the phone. She was just like, do you have any questions? I'm like, no, I mean, I feel like the first term went fine. And, all of a sudden there's a cliffhanger when I have to reapply of like, oh my gosh, the intravenous drug using population, HIV, that's my passion. So yeah, and then there is another person that's working with Jacob's office that we've been kind of playing telephone and email tag, trying to connect around the unsheltered community members and discuss that a little bit further. Because I mean, honestly, it would be kind of nice to connect and maybe have a better answer for people who do kind of see the eviction responses to this. And I'm guilty of this myself. But also offer more context into the solutions that are happening behind the background. But yeah, I mean, like the evictions are something that it triggers emotions with me, and it makes me freak out about like the public health nightmare, the lack of dignity that's being offered to people who are having their tents ransacked. So hoping to connect soon.
Yeah, definitely. I'll go ahead and give a brief update about where we're at for membership. So applications for folks who are eligible to reapply came in and have been forwarded to their city council members for approval for another term. Once I hear back from the city council members, I let you know so that you are kept in the loop. And I know that it's been a busy time, so sometimes I have to prompt them like, hey, I wrote you about this 2 weeks ago. Where are we standing? And that's fine. My hope is that I can get all of the approval process done and a slate of candidates presented to the city council before the end of the year, and preferably doing that in November, because once it gets to December, they really focus only on the budget. So so getting it done in December is about impossible. I did have an affirmative from the council president Bender's office that she wants to appoint someone to the committee, and that's been a vacant position, so that was good. And then the other vacancy that we have is in Ward 9, and so I sent those applications to Council Member Cano. And there's also a vacancy in Ward 4, and I sent those applications to Council Member Cunningham. So, we're very much in the process. We have received a number of great applications for the open at-large seats. So I think last month, there were a few folks who maybe volunteered to help look at those applications again, and we'll try and get together in November.
Wonderful.
So that we can keep our own process moving forward.
Come January, we want people here, and we want to get to work immediately in 2020.
Yeah, we want to both welcome the new people, and at next month's meeting, we will also offer certificates for the folks who are leaving the committee.
Because again, there's no meeting in December.
Correct. Also, I should say also at next month's meeting, we need to approve the meeting dates for 2021. Hattie will need to enter those into this, computerized system, the legislative information management system, to make sure that we can get our meetings on the calendar. I'll prepare the dates, like I do every year, and I'll just email those to everyone so that you can get them on your own calendars. It's always the fourth Tuesday of the month. Our meeting dates have really rarely changed. The only time that we did that was when they fell during the same week of Thanksgiving. And after doing that a couple of times, most of the committee members were like, yeah, we don't need to do that. Like, let's just go with whoever shows up on those meeting dates, and they're the meeting dates, because then it's a consistent day of the month every month. So
Okay, we've gotten to meeting dates, so I figure we can get out of here.
Amen to that.
I hope you all have a wonderful, wonderful rest of your week. And
Happy Halloween.
Soon.
Happy Halloween and happy election.
Yeah.
That's for real.
Happy
Bye-bye.
Fingers crossed it's a happy election.
I hope we have
So
something to
great to see
celebrate
you
next
all.
time we see each other.
Yes, please.
Hopefully, yeah.
All right, adjourned.
See you all.
All right. Bye, everybody. Thanks for coming.
Thank
Great
you.
meeting.
Great meeting, I agree.